With lower immunization rates driving a measles outbreak in Ontario, public health authorities are being urged to step up vaccination and messaging efforts as the case count in this province exceeds 1,200. Joining me now is Ontario's Chief Medical Officer of Health, Dr. Kieran Moore. Doctor, thanks so much for making time this morning. I really appreciate it.
My pleasure, Karen. Thank you.
Well, measles cases in this province, as I just laid out, have topped 1,200. That far exceeds the annual totals recorded over the past decade. What has been the biggest challenge for public health authorities right now?
The biggest challenge is that a vast majority of those 1,200 cases were unimmunized, and we have to break some of the hesitancy, build confidence in the measles vaccine. It is such a safe, effective vaccine. We have 50 years of history of safety with this vaccine, and it's almost 97% effective at preventing measles after 2 doses. So we want to work on prevention. It's the best strategy against measles. It's the best means of staying protected, and we need to encourage everyone to stay up to date and to review whether they're protected with those 2 doses.
Public health authorities do aim for 95% of people in a community to be protected from measles to prevent outbreaks. Vaccination rates are really nowhere near that in many places. Why has getting more people immunized not been easy for public health?
It's not been easy because, people are busy. They have many priorities, but I hope through this type of communication, we can raise the awareness, have immunization be prioritized. It's a global phenomenon right now. So anytime you're traveling outside of Canada, the risk is there. And we want to make sure we don't bring measles back. And we want to ensure that we can get this under control in the southwest of Ontario. So measles vaccination is the best means of preventing this particular virus.
So then why not hold vaccination clinics across the province? Because in terms of having 95% of a community protected from measles, Kingston right now and the surrounding areas is the only area, I should say, that has met that goal for 7-year-olds in Ontario. So why has the province opted not to hold vaccination clinics? Because as you mentioned, people are busy.
So you can get immunized through your primary care provider, through a community health center, through your local public health agency. Those 3 named agencies are active in immunization. You can contact them to book an appointment. The health units are also working through the Immunization of Students' Pupils Act to try to ensure that our schools are best protected. And anyone that hasn't brought their records forward brings them. And if they're not up to date, they'll be offered vaccines. So that's been occurring since 2023, where we're trying to build that wall of immunity to protect everyone in Ontario. But there will be some that haven't been able to keep up to date and or are hesitant. And our health units are there to talk to those communities to try to build back the confidence in this excellent and safe vaccine.
And while that's great information there about how you can get vaccinated, I mean, you've just laid out what a challenge it's been to reach more people to get vaccinated. So respectfully, the basis of my question was, why is Ontario not holding vaccination clinics?
Well, I just want you to let you know that we've got ample vaccine and we have ample opportunity to vaccinate. Those clinics are available through our local public health agencies as well through our primary care partners. Our primary care partners are working full out to try to promote the vaccine and to ensure that Ontarians are protected. That's been happening since 2023. There are some that we still have to go after, but we do have high rates of immunization, as you've said, in some regions of the province. And in our high schools, in particular, 17-year-olds, we have rates of 92 to 97% protection in those environments. So we are doing well, but we do have gaps and we have to work on those for sure.
I'll just clarify that what I said was the only public health unit that has reached 95% of people immunized to prevent an outbreak was Kingston. That's what I said there. I guess, how do you respond to criticism from some doctors that believe the response from public health has been muted?
I think it's difficult when we're working with some communities to try to promote vaccination. And the 4 health units that have the highest numbers of cases now have been working diligently for a very long time with these affected communities to try to ensure that they're aware of the vaccine, that they build confidence in the vaccine. So that work's been going on year after year across public health. We can do more, and our health units are reaching out to affected communities to try to build confidence and support them. But this is a very tricky, aggressive aggressive virus, and if there's any gaps in our community, it will find them. So I appreciate the opportunity to speak to you today to raise awareness, to stay protected. The vaccination against measles is our best means of prevention, and it is available across Ontario. We have no issues with supply. We have plenty of vaccine, and we have plenty of health units participating in this robust immunization program.
Okay, unfortunately, I have to leave it there. I'm out of time. Dr. Kieran Moore, really appreciate you taking time for the conversation this morning.
Thank you, Caryn.